I'd like to thank everyone for coming this afternoon to this press conference. As a career soldier and Vietnam veteran, General Eric Shinseki, Secretary of the Department of Veterans Affairs, has served his country well. His patriotism and sacrifice for this nation are above reproach. However, his history, his record, as the head of the Department of Veterans Affairs tells a different story. It's a story of poor oversight and failed leadership. As National Commander of the nation's largest veteran service organization, it is with great sadness that I call for the resignations of Secretary Shinseki, Undersecretary of Health Robert Petzel, and Undersecretary of Benefits Allison Hickey. It has been more than 30 years since the American Legion has called for a resignation of a public official. It's not something we do lightly. But we today, because it is our responsibility as advocates for the men and women who have worn this nation's uniform. In late April, allegations from multiple whistleblowers surfaced of a secret waiting list at a Phoenix VA healthcare system that may have resulted in the deaths of approximately 40 veterans. VA previously had acknowledged that 23 veterans throughout the healthcare system had died as a result of delayed care in recent years. And then yesterday, a copy of the findings of an investigation by VA's Office of Medical Inspector was shared with USA Today. Those results, clerks at the Department of Veterans Affairs Clinic in Fort Collins, Colorado, were instructed last year how to falsify appointment records so it appeared the small staff of doctors seeing patients within the agency's goal of 14 days, according to the investigation. These disturbing reports are part of what appear to be a pattern of scandals that have infected the entire system. At the VA Pittsburgh healthcare system, continuous management failures led to a deadly Legionnaire's disease outbreak. VA Pittsburgh Director Terry Wolf still received a perfect performance review, and Regional Director Michael Moreland, who oversees VA Pittsburgh, collected a $63,000 bonus. In Augusta, Georgia, local VA leadership first learned of delays in providing gastrointestinal services to veterans on August 30th, 2012. 3 cancer-related deaths have been affected by delays in diagnosis. In Atlanta, despite 4 preventable patient deaths, 3 of which VA's Inspector General linked to widespread mismanagement, former Atlanta VA Medical Center Director James Clark received $65,000 in bonuses over 4 years. When the Phoenix allegations broke, the American Legion reacted swiftly, calling for a full investigation and, if the allegations were true, the Secretary Shinseki holds those responsible individuals accountable. But with Sunday's report from Fort Collins, Colorado, and Cheyenne, Wyoming, it is obvious the issues are more widespread within the VA. Those problems need addressed at the highest level, starting with new leadership. The existing leadership has exhibited a pattern of bureaucratic incompetence and failed leadership that has been amplified in recent weeks. Patient deaths are tragic, and preventable patient deaths are unacceptable. But the failure to disclose safety information, or worse, to cover up mistakes, is unforgivable, as is fostering a culture of non-disclosure. VA leadership has demonstrated its incompetence through the preventable deaths of veterans, long wait for medical care, and benefit claims backlog numbering in excess of 596,000, and awarding of bonuses to senior executives who have overseen such operations. Some veterans have waited years to have their claims adjudicated. That same leadership has failed to provide answers as to why these issues continue to occur. Our veterans need to know that the VA healthcare system is a safe place where they can receive treatment and feel assured that patient safety is a top priority. But the American errors and lapses can occur in any system. But the American Legion expects that when such errors and lapses are discovered, that they are dealt with swiftly and that responsible parties are held accountable. This has not happened in the Department of Veterans Affairs. There needs to be a change, and that change needs to occur at the top. Thank you.